muscles of the shoulder. These are muscles that move your shoulders. Now, the major bone of your shoulder is your scapula, your shoulder blade. So if a muscle is going to move your shoulders, it's going to attach or insert on your scapula. There are three muscles that we're going to learn that move your shoulder, your scapula. They insert on the scapula. The most important of the three is the trapezius. That's the biggest and most important of the three. The other two are the rhomboideus and the serratus anterior. Now, how does the trapezius get its name? This picture just shows the right trapezius of this person. There's also a left. All muscles are paired. It gets the name trapezius because of its shape. It reminded the anatomist of a trapezoid shape. This is a trapezoid. Okay. All right, so use your imagination. You know, they said it looked like a trapezoid. They called it the trapezius. Now, the muscle originates actually along from the occipital bone all the way along the spinous processes of the vertebrae down to really the lower thoracic vertebrae. So it really originates along the entire vertebral column. It inserts on both the scapula and also the clavicle. And it actually has 3 points of attachment or insertion. Now, in the cat, this trapezius muscle appears as 3 separate muscles. In us, it looks more like one muscle. However, even though it looks like one muscle, there are actually 3 nerves that control the trapezius. So in fact, there is really an upper part of the trapezius, a middle part of the trapezius, and a lower part of the trapezius. In the cat, you really see the upper, middle, and lower part. And us, even though it looks like one muscle, we can control and make just the upper part contract, the middle part contract, or the lower part contract. So the upper part of the trapezius, and I'm not going to ask you to learn it, but if you're a future PT or OT, learn it. Okay? They will expect you to know it. The upper part, and this is all written on page I-10. Let's look on I-10. On the next page, so I wrote on I-10, the trapezius really is made up of 3 parts: a clavotrapezius, a spinotrapezius, and a acromiotrapezius. The upper part is called the clavotrapezius. The clavotrapezius, the upper part, is used, since it originates on the it's the upper part here, and it inserts on the clavicle, it pulls your shoulder up. So when you raise your shoulders up, can you shrug your shoulders? Can you move them up? You're using the upper part of the trapezius to raise or pull your shoulder upwards towards your head. Now, the middle part, called the acromiotrapezius, because it technically inserts on the acromion process of the scapula, when it contracts, it pulls your shoulders towards the midline. It brings your shoulders together on the back side. This is called adducting, or retracting your shoulders. Adduction means adding them together, bringing them together. So when you pull your shoulders together, you're using the middle part of the trapezius. And then we use the lower part of the trapezius, called the spinotrapezius, which technically inserts on the spine of the scapula, to lower our shoulders. We can pull them down. So in fact, we use the trapezius, the upper, middle, and lower part, to move our shoulders up, to pull them backwards, to lower them down. So like, you know, we commonly will move our shoulders like this. And the trapezius is the major prime mover. Let me mention a couple of other things about the trapezius. So you've got really a right and a left one. They're located right here. They're between your shoulder blades, right? Between your scapula. This seems to be where we build up a lot of tension. And that's why one of the most favorite places we all love to be massaged is right here. This is the area where everybody likes that massage. Right between your shoulder blades. And what I've noticed is not only do we as humans like to be massaged there, so do dogs and cats. Not only does a lot of tension develop in the trapezius goes all the way, that's what's located on the back side of our neck. It originates at the top of our occiput, right here in the lower part of the occipital bone. So it's on the back side of your neck is the trapezius. So also when you have a stiff neck, when your neck is stiff, when you have a, quote, cold in your neck and it's stiff, that's the trapezius. So that trapezius is a major muscle. We use it to move our shoulders. We seem to build up a lot of tension in it. All right, so I've summarized the trapezius. In fact, it's the very first muscle on the first side of our chart. It originates on the vertebral column. Really, it originates all the way up on the occipital bone. It inserts on the clavicle and scapula. It elevates, and it means it raises up and adducts, pulls our shoulders together on the back side, among other actions. There are two other muscles that also move the shoulders. Let's just look on this chart since we're on it. The rhomboideus and the serratus anterior. The rhomboideus originates on the vertebrae, also inserts on just the scapula. Notice the trapezius inserts on both the clavicle and scapula. It adducts the shoulders. The serratus anterior originates on the ribs. It inserts on the scapula. It pulls your shoulders down. These two muscles are not in bold print. They are helpers. They are synergists. Last class meeting, we said that there are the major muscle that moves, creates a certain movement. That's called the prime mover or agonist. And then there can be smaller muscles that help. They're called synergists. They work with the prime mover. So the rhomboideus and serratus anterior are helpers or synergists. We can see them pictured on I-9. On I-9, the rhomboideus is shown right here. It's actually underneath the trapezius. You actually have to remove the trapezius or pull it to the side to see the rhomboideus. The rhomboideus is a much smaller muscle than the trapezius. It's a helper. It's a synergist. It originates on the vertebral column. It inserts on the medial border of the scapula. When it contracts, it pulls your scapula closer to the vertebral column, which it effectively adducts or retracts or pulls your shoulders together, moving them backwards. It adducts your shoulders. Again, it's a helper muscle. Incidentally, if you look in the lab manual, you will see that this is more complicated than what I've said. There's actually a rhomboid major, a rhomboid minor, a rhomboid capitis, a rhomboid cervicis. So remember, there's over 650 skeletal muscles in the body. I have not given you a list of 650, so there's a lot of stuff I'm leaving out. All right, that's the rhomboideus, and then the serratus anterior is shown right here. The serratus anterior originates on the ribs, and it inserts on the inferior border, the lower border of the scapula. And this muscle pulls your shoulders downwards towards your ribs. And technically, it's really a, quote, switch hitter. It can actually either pull your shoulder down to your ribs, or it can be used to raise your ribs up to help you breathe. Another picture of the serratus anterior is if you look on page I-8. On I-8, on the bottom picture of I-8, so this, you'll notice right here, is labeled the serratus anterior. It's going from the ribs to the scapula. And with this view, we can see why it got the name serratus anterior. Serratus means like the edges of a serrated knife. A serrated knife is a knife with teeth, right? It's got those sharp teeth. So this reminded the anatomist of the sharp teeth of a serrated knife, like a steak knife, and since it's on the front or anterior side of the body, they called it the serratus anterior. On page I-10, so now that we've mentioned three muscles that move our shoulders, the most important is the trapezius. Now, on the middle of I-10, I want to mention muscles that abduct the upper arm. Abduct Last week we talked about these movements. Abduction, like when a child is abducted from their home, means taken away. So moving your arms away from your body is abducting your upper arm. So there are two muscles that abduct our upper arm. They insert on the humerus. That means they move the humerus. The more important of the two is called the deltoid. The less important is the supraspinatus. Let's look at a picture of the deltoid by looking at page I-8. And on page I-8, on the bottom picture, this is the deltoid muscle. It's this prominent muscle on the top of your shoulder. It gets the name deltoid because it reminds anatomists of the letter of the Greek alphabet called the delta. That's a delta sign. It's interesting that in Greek and in Hebrew, you actually have alpha, beta, gamma, delta, and in Hebrew it's aleph, bet, gimel, dalet. Same sounds. So, but anyhow, so this is a triangle-shaped, the delta D letter looks like a triangle. It reminded them of a triangle. This is a very important muscle in that it's one of the most common muscles where you give intramuscular injections. All of us have gotten vaccinated or gotten shots right there in the shoulder. Now, in fact, the deltoid really consists of three parts, just like the trapezius muscle does. In the cat, you will literally see three parts. There's really an upper, middle, and lower part of the deltoid, or front, middle, and back part of the deltoid, just like there was an upper, middle, and lower part to the trapezius. And in fact, on the cat, they are called the clavodeltoid, the acromiodeltoid, and spinodeltoid. It gets the three names from the fact that they originate at 3 points on the clavicle, the acromion process of the scapula, and the spine of the scapula. But all three parts insert on the humerus. And what this muscle does when it contracts is it pulls on the humerus, pulls on the upper arm, and tries to move it closer to your top of your shoulder. And as it tries to pull that humerus, the upper arm, closer to your shoulder, it raises and pulls your upper arms up and out. That's called abducting the arms. What about the other muscle we mentioned on I-10 at the bottom? And incidentally, you'll notice I did write on I-10 about how there's really three parts to the deltoid. The helper muscle is the supraspinatus. And we can see a picture of it on I-11. You'll notice the spine of the scapula. You'd say, well, I don't know what the spine of the scapula means. Okay, so on us, this is the spine of the scapula. That's what you feel when you feel the backside of your shoulder blade or scapula. And the space above the spine is called the supraspinous fossa, and that's where the supraspinatus originates. It inserts on the humerus, and the deltoid sits right on top of it. So in this picture, the deltoid has been removed. So you can see the supraspinatus above the spine and the infraspinatus below the spine. And basically, just like the deltoid, it pulls on the humerus, the upper arm, moving the upper arm closer to the top of the shoulder, abducting the upper arm. So this is exactly what we wrote on side 1 of our one-page handout. You can see the deltoid is in bold print. It originates on the clavicle and scapula, inserts on the humerus. It abducts the upper arm. Right below the deltoid is the supraspinatus. It's not in bold print. It's a helper. It's a smaller helper or synergist originating on the scapula, inserting on the humerus, but also has the same action. So if you're going to learn them, which one should you learn first? The deltoid. On the top of I-11, it says at the top, muscles that adduct the upper arm. I add arm, but let's be more precise, the upper arm. So these muscles are the antagonists of the deltoid and supraspinatus. If the deltoid and supraspinatus abduct the arms away from the body, the upper arm, these are muscles that adduct the arms back to the body. There are two huge muscles that adduct the arm. They are the pectoralis and the latissimus dorsi. Since these are muscles that are pulling the upper arm towards the body, they must insert on the humerus, because that's what they're pulling on, the upper arm. The pectoralis is pictured on I-7. Everybody knows the pecs. This huge chest muscle, fan-shaped chest muscle. So the pectoralis originates on the sternum and the clavicle. So it's originating on the sternum and clavicle. It inserts on the humerus, around the intertubercular groove. And so one of the main actions, not the only action, but one of the main actions that we're going to emphasize is, think about this. What does every muscle do? It pulls the insertion towards the origin. If your arms were outstretched, and here's this large muscle originating on the sternum and clavicle, inserting on the humerus, what's it going to do? It's going to pull on the humerus and pull it closer to your sternum, causing adduction on the front side of your body. Now it has other actions as well. So if you work your pecs, you're going to do more exercises than just bringing your arms to the midline, but that's one of its actions. All right, so that's the pectoralis major. Adducting the arm, that makes it an antagonist of the deltoid. So here's what you're going to do when you've got nothing better to do. Deltoid, pectoralis, deltoid, abduct, pectoralis, adduct, abduct, adduct, abduct, adduct, deltoid, pectoralis. And that's how we use the muscle. If you were using weights, and you might alternately spread your arms out and bring your arms together, bring your arms out and bring your arms together with a weight, you would be alternately using your deltoid and your pectoralis, because that's how we use them, agonist, antagonist. Now, another huge muscle is the huge lats. If these are your pecs, this is the lats, the latissimus dorsi. What's dorsal or dorsi mean? Back. It originates on the back. It originates in the thoracolumbar vertebrae. I wrote fascia here, but I think it'd be better to say thoracolumbar vertebrae would be the better term. It inserts on the humerus. It also adducts the upper arm. And it has, like all these other big muscles, it has more actions as well. It also causes medial rotation of the upper arm. The latissimus dorsi is this huge muscle right here. You have a right and a left. This picture just shows the right one. It's originating in the thoracic and lumbar vertebrae. So for this, you should say thoracolumbar vertebrae. You shouldn't just say whole vertebral column. And it inserts on the humerus. So again, if your arms were outstretched, what is this muscle going to do? It pulls the insertion closer to the origin. It pulls the humerus closer to the lower back. So this muscle is pulling your arms towards your body, adducting your upper arms, but pulling them to the backside. So think about this. What's the difference between the pecs and the latissimus dorsi, the lats? They both bring your arms towards the midline, towards your body. But the pectoralis that originates on the front of your body, on the sternum, pulls your arms to the front. Your latissimus dorsi pulls your arms towards your body to the back. So it's a slightly different motion. Okay, so when do you use your lats? You really use your latissimus dorsi for swimming. Because when you swim, don't you pull your arm backwards, right? So you pull your arm backwards. All swimmers have huge latissimus dorsi because that's what they're exercising all the time. And a particular type of swimmer that especially has huge lats are those who do the butterfly stroke. Does anybody know the butterfly stroke? This is like this, and it's a really powerful, I'm probably not doing it right, but it's a really powerful backward stroke with the whole arm. And that really uses the latissimus dorsi. Another place where you would use it is if you were paddling a canoe, right? You had an oar, and when you're paddling a boat, aren't you, the oar starts out in front of you, and you pull it back. And notice what I'm doing with my arm. I'm pulling it back towards my body. I start out stretched and bring it back closer to my body towards the backside. So if you want to help yourself learn this weekend, go out to a lake where they have a little paddle boat, right? Rent a boat and paddle around for a half hour until it hurts so much here, you're going to remember where the latissimus dorsi is. The next muscle listed is the teres major. The teres major is the next muscle listed. The teres major. Now, the word teres, I'm going to tell you what it means. So if I'm going to tell you what it means, what do you know that means? You're going to see this word again. The word teres means little round muscle. Means small and round. So teres major is a little round muscle. And we're going to see there's another muscle that has the word teres in it. We'll get to it later. It's called the pronator teres. So it's always a little round muscle. This muscle is right here. It's this little round muscle right here. It is just above the latissimus dorsi. It originates on the bottom part of the scapula, and it inserts on the humerus almost exactly where the latissimus dorsi does. It basically is a helper or synergist of the huge latissimus dorsi. So it does exactly what the latissimus dorsi does. It adducts the upper arm and rotates it medially. If we were looking at our summary chart, the muscles we've been mentioning so far is the pectoralis, the latissimus dorsi, and those are both in bold print. 100% probability they're going to be asked. And not in bold print is the teres major, a helper. The location of the teres major is it's right above the latissimus dorsi. It's below the infraspinatus. This is the supraspinatus, the infraspinatus, and the teres major. That's the order that you'll see them on the back. All right, the infraspinatus. The infraspinatus, which is right here, originating below the spine of the scapula and inserting on the humerus, actually has the opposite action of the latissimus dorsi and teres major. It rotates the upper arm laterally. One of the other actions of the latissimus dorsi and teres major is to rotate the upper arm medially. But it rotates the upper arm laterally. Now you might say, I don't know what you're talking about. So let's try to do that. Let's rotate our entire arm medially and then laterally. All right? And the motion is occurring. The motion is occurring up here in our shoulder and upper arm. Now, incidentally, we'll get to this next time. We can rotate our arm like this, the whole arm, involving both our upper and lower arm, or we could just rotate our hand. Why don't you just rotate your hand? Keep your upper arm stable. Do you see that? So we can rotate just our hand, or we can rotate our entire arm. Those are different muscles. All right, the last muscle we're going to mention is the subscapularis. The subscapularis, obviously from its name, originates on the front side of the scapula. The subscapular fossa inserts on the humerus. And it, again, rotates the upper arm medially. In that respect, it's a synergist with the latissimus dorsi and teres major. There are four small muscles. There are four relatively small muscles that all originate on the scapula in different places on the scapula, and all four insert on the humerus. And these four muscles are collectively called the rotator cuff muscles. They include these four small muscles, the subscapularis, the supraspinatus, the infraspinatus, and the teres major. Three of the four are shown right here: supraspinatus, infraspinatus, and teres major. And then the one on the front is called the subscapularis. Collectively, they are called the rotator cuff muscles. All right, fine. So, who cares? Who remembers what the most movable joint of the body is? The shoulder. The shoulder is the most movable joint. Sounds like a question I might ask on an exam. What's the most movable joint? The shoulder is circumduction, 360-degree circumduction in any direction. This is the most movable joint in the body. We had mentioned that sometimes what you gain in mobility or flexibility may cause a decrease in stability. So if this is the most movable joint in the body, it's also one of the more easily dislocated joints or bones, because we've got this head of the humerus that really swings, rotates pretty freely in this ball and socket joint between the head of the humerus and the glenoid fossa. And this can actually dislocate. It can pull out. Now you'd say, yeah, how? So I'm sure there's a lot of examples. I'm going to use this example because I think you can relate to it. A Major League Baseball pitcher throws a hard baseball overhead. How fast can a Major League professional pitcher throw a hard baseball, approximately? Not quite 100, but they can pitch it about 70, 80, 90 miles an hour. None of you can do that. Now you'd say, how does he know? He doesn't even know me. None of you can do it because there are very few people in the world that can do it. Most of us would be lucky to throw a baseball 20, 25, 30 miles an hour. They are throwing a baseball 70, 80, 90 miles an hour. To go and create that kind of speed, they practically pull their arm right out of its socket. They practically do it. Most professional pitchers cannot pitch for 9 innings, which is how long a baseball game goes. They can pitch for maybe 3, 4, 5, 6 innings, and then they have to be relieved. And then they ice down their shoulder because they have basically torn all kinds of parts in their shoulder. Some of you know pitchers do not play every game. They have to rest for a few days before they can pitch. That's not true with any of the other players. Is that right? All the other players play every game. The pitchers, they rotate because they destroyed their shoulders. They constantly take anti-inflammatory drugs, and they are destroying their shoulders. It's brutal to the body. Your obvious question is then why do they do it? You know the answer. They get paid a lot of money. All right? That's why athletes do what they do. Why do you think football players who tend to suffer concussions and permanent brain damage do it? The money. Okay, so now we're clear on that. Incidentally, in case you're thinking that they're so mercenary, that they are willing to do terrible things to their body just for the money, I have a question for you. Why are you working so hard in this anatomy and those other science classes? Let's be honest. Why are you willing to work so hard, get less sleep, and study harder than the other students who are history majors or business majors? Why are you willing to work so hard? Because it pays well. Trust me, you're not all here to save mankind. Some of you are, but I'm telling you, if it didn't pay well, you wouldn't be working this hard. So let's not make fun of the athletes because you're not that far different. There are 4 little muscles that help keep your humerus, your upper arm, connected to your scapula. Those are those 4 rotator cuff muscles. But when you do these kind of motions, it can tear those 4 muscles that help stabilize the shoulder joint. And when you tear those 4 muscles, that's called a torn rotator cuff, which requires surgery. On page I-12, we have this drawing of the back side. Here's the right and left trapezius. You can see just how big they are. Very large, prominent muscles, originating on the vertebral column, inserting on the scapula and clavicles. Here's the deltoid, the big shoulder muscles. Remember that on the cat, the deltoid is also made up of 3 parts, just like the trapezius is made up of 3 parts. On the back side, there is a large sheet of connective tissue. This large sheet of connective tissue in the lower back is called the thoracolumbar aponeurosis. Now, I know that when you look at the word aponeurosis, you're thinking, what does it have something to do with like being neurotic? But the word actually has nothing to do with nervous system in this case. It just refers to a broad sheet of dense fibrous connective tissue. And since it's located in the lower back, the thoracolumbar area, it's called the thoracolumbar aponeurosis. What you will see on the cats is that I have cut through this thick connective tissue covering, and I have exposed those erector spinae muscles, the spinalis dorsi and longissimus dorsi. So you will see them exposed. Remember, these are the muscles right here that we saw pictured on I-9. Now, there's also a broad sheet of connective tissue or fascia on the abdominal side. You can see a picture of this. Let's look on I-7. There's, on page I-7, a thick sheet of dense fibrous connective tissue in the abdominal area. It's been removed on this half, but it's shown on this half. This is called the abdominal aponeurosis. If you look on the chart, here's the abdominal aponeurosis here, and here's the thoracolumbar aponeurosis here. So you should know what an aponeurosis is. It's a thick sheet of dense fibrous connective tissue. I'd like you to notice what creates your armpit. Your armpit is actually a space created between two muscles. There is this muscle right here on your chest called the pectoralis. And there is this muscle, this huge muscle that originates on your lower back that attaches on the underside of your humerus called the latissimus dorsi. And this big space between the muscle on the front, the pectoralis, and the latissimus dorsi from the back creates your armpit. Right in that armpit space, you can see the serratus anterior.